Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
This is the vision the government has for the NHS, a 24/7 service that can offer peak performance whenever you need it. But documents seen by this programme have shown there are doubts about the policy, even in the heart of the Department of Health itself. Senior civil servants are concerned at the lack of detailed costings or risk assessments of the proposals. They even say the plan may not be workable. Here's our health and social care correspondent, Victoria MacDonald.
It is one of the government's key election commitments, a 7-day NHS to be delivered by the Health Secretary Jeremy Hunt by 2020. Hospitals and GPs accessible every day. But now there are warnings from within the Department of Health itself over the risks with this policy. Documents leaked to Channel 4 News and The Guardian newspaper show that civil servants have very real concerns over the 7-day NHS policy, how it will be funded, how it will be staffed, where the evidence and data is for such a policy, even what the impact will be on the NHS overall. Yet the government has repeatedly dismissed concerns, including from its own Public Accounts Committee and from the King's Fund think tank over staffing and funding for this policy.
For the past 12 months, we have pushed the government on what their plan is for this. However, to see today in black and white that not only has the government disregarded the advice from numerous leading healthcare organisations, they've also chosen to ignore their own risk assessment is alarming and incredibly unnerving.
Yet it is clear from these documents that the Health Secretary himself and the new health ministers have been warned. One document that we've seen, dated the 25th of July, is the Risk Register for 7-Day Services programme. It includes the risk that there won't be enough money to meet the deadline for the complete rollout, that there isn't enough data to track performance to ensure the policy can be delivered, and crucially, that it won't be possible to find enough skilled staff, meaning the full service cannot be delivered. A second document, marked sensitive, also says there are risks that
the detailed costs of delivering in hospitals, including accurate estimates of additional workforce requirements, are not understood early enough.
This comes following evidence of serious gaps in hospital rotas even now, and amidst claims today that thousands of operations and appointments are to be cancelled in a bid to stop the NHS buckling under this winter. Yet in another document, building the evidence base, it is clear that no impact assessments have yet been done into how 7-day services will actually affect hospitals, GPs and urgent and emergency care. The pledge for a 7-day NHS was at the heart of the bitter dispute with junior doctors, leading to unprecedented strikes.
The most striking revelation is the fact that this 7-day policy is the antithesis of what a health policy should be. A health policy should be like any other intervention in the NHS, any new drug, any new treatment. It should be based on evidence. It should not be a triumph of spin and rhetoric over the evidence. It should be grounded in facts, in academic papers, in research, because only then can you be confident that the policy is actually going to do good for patients and not harm.
The Department of Health said,
over the past 6 years, 8 independent studies have set out the evidence for a weekend effect, unacceptable variation in care across the week. This government is the first to tackle this, with a commitment to a safer 7-day NHS for patients and £10 billion to fund the NHS's own plan for the future, alongside thousands of extra doctors and nurses on our wards.
But what is clear from these documents too is that ministers have also been warned that lack of staff and money could in the end mean this key government promise of a 7-day NHS being in place by 2020 may not be met.
We're joined now by Professor Jane Dacre, the President of the Royal College of Physicians. How surprised are you?
I'm not surprised at all. Our fellows and members, the physicians in this country, have been telling us for at least the last couple of years that there are not enough doctors to deliver the service as it is now. And so it doesn't surprise me that we can't deliver the service with an extra 2 days. Now, let me be clear about our thoughts on a 7-day NHS, which is that we would welcome it. We would be very keen to give the same quality of care for patients 7 days a week as we're able to do in 5. But at the moment, we're struggling to deliver good quality care over 5 days. So to just expand that to 7 days and expect the quality to be the same is it's not surprising that there are problems.
Isn't there going to be a certain amount of just expected gripes from people who don't want to change the way they're doing things?
There always are gripes with people who don't want to change, but I don't think that's the case now. I think people are working hard. They are able to and would be willing to work across 7 days. But it's difficult to deliver the quality of care that you need across 2 extra days without 2 extra days worth of people to deliver that service.
I mean, the government's saying we've given £10 billion of extra funding. If that doesn't do it, what does?
Well, I think it's a bit more complicated. I think that the patients that are coming to the NHS, the patients that are coming to emergency departments and are being admitted to hospitals these days are older. They're sicker, they have more than one problem. And also, for a number of reasons, the number of doctors available to treat those patients is actually less than has been expected. Now, part of that is because of changing demographic in the workforce. Part of it is because of changes to immigration law. So actually...
Less than expected, but more than it was.
More than it was.
I mean, the number of doctors is going up.
Yes, but it's going up in small terms percentage, but actually it isn't enough to deliver the service. We have seen from surveys that we've done that 40% of new posts for consultant physicians on average were not filled last year. So the trusts, the hospital trusts, say they need those doctors. They advertise for those doctors, and there aren't enough suitably qualified applicants.
We still don't know, do we? I mean, what's going to happen with the junior doctors dispute? Where do you stand on that? I mean, you know, if you were advising juniors now as to whether to continue their strike action, what would you say? I
would tell people to think very, very carefully about the effect of whatever they did on patient care. And I think at the moment, the NHS is in a very difficult position with funding, with being overstretched, with difficulties in staffing. And so I think people should think very, very carefully before doing something that might compromise patient care. Do you think they're right in terms of their concerns? Because they're the ones who've been warning that this 7-day plan isn't workable before we saw any of these leaks. I think that their morale is very low. I think that there are gaps in their rotas. There's no doubt that there are gaps in their rotas. And there's no doubt that there are not enough doctors to run a 7-day service at the moment. However, I think a lot of their concerns about the junior doctor's contract are actually to do with non-contractual issues, and that's to do with the morale of the workforce. And that's not actually to do with the delivery of a 7-day service. Were you as shocked as many of them were that Jeremy Hunt was reappointed Health Secretary? I don't know. I'm not able to comment on that. I mean, you've got to go into the department and deal with these people, haven't you? Absolutely. And actually, Jeremy Hunt and I and the junior doctors all want patient care to be better across 7 days. We need to work more effectively together to do that. And I would say that at the moment, to be able to do that, I think that we need more doctors. I think that we probably need more nurses. We also, if we want to work 7 days, need more than just the doctors at work at the weekends. We need pharmacists to deliver the drugs. We need occupational therapists. We need physiotherapists. And so if we're going to increase to a 7-day service, we need to be resourced, and we'd be delighted to do it. Professor Dacre, thank you very much. Thank you. Well, tonight's main news, this programme has seen internal Whitehall documents that show severe doubts among government officials over the workability of plans for a 7-day NHS. Officials question the data and evidence to support the policy and whether there'll be enough money or staff to deliver it. The President of the Royal College of Physicians told this programme she was not surprised by the doubts expressed. We would be very keen to give the same quality of care for patients 7 days a week as we're able to do in 5. But at the moment, we're struggling to deliver good quality care over 5 days. So to just expand that to 7 days and expect the quality to be the same it's not surprising that there are problems.
Our health and social care correspondent Victoria MacDonald, who broke the story, is here. How worrying is it for Jeremy Hunt?
Well, what these civil servants have identified is more than a dozen risks, including, actually, which we didn't mention in our piece, Brexit. What happens if you suddenly lose all this staff? The NHS is already suffering from a lack of doctors and nurses. Brexit may further harm that, which will then in turn mean that it makes it more difficult for a 7-day NHS. Now, the Department of Health would say that risk assessments are about the worst case scenario, but one other thing that's come out of it is, what if it happens, what if it doesn't produce the desired result? And what is that desired result? To make a safer NHS at the weekend and to improve the quality of care. Now, it turns out from these documents that they're not even sure that their policy can produce that. So they're going into this flagship policy that the government had made an election pledge without actually knowing that there is any evidence that it will work and whether the data is available for this.
Victoria, thank you very much.
I've been